In part one of our Hospital Community Cooperative podcast, we met Maurice Jones, CEO of the local Initiative Support Corporation, and discussed social determinants of health and how hospitals and community development organizations can advance health equity through collaboration. This week, we continue that conversation. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, senior writer for AHA. In part two of this podcast, Jay Bhatt, senior vice president and chief medical officer of the AHA, continues his conversation with Maurice Jones about the next frontier of partnerships between community development organizations, hospitals, and health systems.
Maurice, you alluded to several approaches in terms of hospital and community development organization partnerships. From your view, what do you think the next frontier of partnerships between organizations like yours and hospitals, health systems looks like? Are there particular approaches you're seeing emerge that are having traction? Could you talk a little bit about sort of how that's playing out?
Yes, sure. Here's what I think is happening now. Where hospitals are feeling the most comfortable getting involved in this work is in the housing space. And so if you look at the work that's being done across the country where hospitals are participating in substantial ways, housing is still the most common area. And I think there are a couple of things moving forward that we're going to see and that are big opportunities. And we're already beginning to see it. We're beginning to see hospitals now broaden the problems that they want to tackle in this social determinant space. So as I alluded, we've got a really, really large healthcare enterprise that started with us in housing. And now in their second effort with us, they're doing non-housing, they're doing economic development work with us. And so they're doing workforce development, they're doing small business development, and they are helping to develop commercial corridors in low and moderate income communities. I think you're going to also see hospitals begin to look at the issues of crime and safety and look for ways to work with communities who are taking a community approach to reducing crime around hotspots, for example. I think you're also going to see hospitals getting into this game or lane of helping communities with issues of resiliency and disaster and trying to make their communities more resilient or more resistant to the impacts of climate change and natural disasters. So I think one area you're going to see is you're going to see hospitals begin to do more things in the social determinants of health space or underneath that umbrella. That's one thing. I think secondly, hospitals are really looking at ways that they can be creative in using, in particular, their financial resources. And so you often see hospitals using their community benefits pool of dollars to invest in this community work. We're beginning to see hospitals with us now utilize not just community benefits resources, but also resources directly from their treasury to make low interest loans to us that we can then turn around and use to make low interest loans for housing work and for small business work, for example. I think you're also going to see hospitals begin to be even more creative or to use even more tools in the impact investing space. And so I think you're going to see hospitals thinking about themselves as an impact investor, and being an impact investor is one of the tools that they can use to make their communities healthier, So I think all of this is underway in the midst of all of the work that we're doing. And you can see right before your eyes how hospitals are just developing new competencies in this space. Let me mention another area. Hospitals are definitely using community partners like us to do this work, but you also have hospitals that are developing these competencies within their own team and actually hiring people who are housing experts, right? And hiring people who know something about workforce development. And so I think you're going to see hospitals' staffs begin to take on the complexion or the semblance of community development organizations themselves, which is really interesting for a group like ours. So we're seeing some incredibly creative, incredibly aggressive, and incredibly bold things coming from our hospital partners in their pursuit of trying to make people in communities healthy and trying to do it with a view to the long term and trying to do it with a view to they know that they've got to get outside of the clinical walls. And so I'm seeing all of these themes as exciting opportunities for the future of this work with the healthcare system.
Thanks, Maurice. And I think you lifted up some points that I wanted to reflect on. One, the notion of strategically making a commitment to this and looking at your assets or lack of in terms of the organization and in the community. This notion of building trust, over time, and we've seen Multicare and others in the hospital community cooperative really work hard at building trust in a meaningful, sustainable way, which I think is critically important to this work. The other is thinking differently about your use of resources around evidence-based interventions and kind of financial investment and impact investing innovation, but also what are the capabilities of your community that you could bring to bear? And this notion that community health needs assessments are intelligence for a community health strategy that includes thinking about strategic actions, the tactical, as well as the resources needed financially. One of the things I think about, how do rural or small community systems or critical access hospitals, do this work? We've seen anchor institutions and anchor strategies get deployed with health systems that have the resources and capabilities, but the challenges to health exist all around our country and in small communities and in places where there might not be as many resources. Can you give an example of a healthcare community collaboration that's, helped sort of support that approach or change the mindset there? Because I think that's important that the entire field sees that they have a potential role and opportunity here to address some of those challenges.
Absolutely. I think the opportunity in rural communities that we're seeing hospitals step into is the opportunity, for example, to use their own facilities as places where these services can be provided to patients and others in their service area. So we're in conversations with a few rural hospitals. One actually is a hospital that built a new hospital, and now they have their old hospital, which is empty, and they're trying to figure out what's the best way to utilize this space in a way that benefits the community. And they are considering a number of different things, but one of which is for this to be a hub of providers for social determinants of health work. Workforce development in particular comes to mind as something that they are contemplating becoming a part of, investing their real estate in and also investing cash in. The real sort of additional big hurdle in most of the rural places where we work is how you tackle this transportation issue. The reality that people are more dispersed, and if you're going to serve them, they have to be able to get to, and it's usually driving to where you are providing services, or you have to take the services to them. And so we've got hospitals trying to figure out in rural areas how they become a part of the transportation solution. And by the way, you've got the same sort of challenges to be addressed. You've got housing challenges, you've got workforce challenges, you've got transportation challenges, you've got diabetes, and you've got obesity, et cetera. And what we're finding is that rural hospitals are often the places in rural towns that really are places with amongst the most assets, whether it be real estate or financial or talent. And the question is how to leverage that on behalf of that community in a way that the community can absorb it and use it. And so we are finding rural hospitals thinking of different ways to do that. But one is really how they use their own space as perhaps a center of activity, and particularly if they have spaces that they're upgrading and moving out of, or a location from which to provide these services.
Excellent. That was really helpful. I think a lot to take home for rural communities and organizations there. And I think that's something we'll continue to see how that develops, because I think that in this country, we've got to see a rural healthcare transformation in order to also collectively move health forward. And so, we have had a great conversation, and we're here coming to the end, and wanted to just ask one more question to you, Maurice, about what advice would you offer to hospital leaders who are exploring partnerships with community development organizations to address the social determinants of health? Are there things that they should do as they think about this work moving forward?
Yes, I think what I would humbly suggest to leaders who are thinking about this work is, number one, really reach out to the communities that the hospital aspires to serve and build relationships there and become scholars of that community so they understand what it is that folks are trying to get done day in and day out, and what the real challenges are. And frankly, ultimately, they build trust, because at the end of the day, trust is going to be the most important currency in determining just how effective hospitals are in doing this work. That's number one. Number two, internally, you've got to have, in addition to, and this is job number one, in addition to a leader that really is committed to getting outside of the clinical walls, that leader has to have an individual, and hopefully several individuals internally, that he or she is making accountable for moving them in a direction here that he or she wants the organization to go in. Because this is a team effort, and you're going to need someone who is spending significant chunks of time working on this and trying to move this forward. And number three, I would say to folks, get a sense of the problems that you want to try to tackle, whether it's housing or whether it's economic development or whether it's workforce development or safety. Get a sense of that and find partners like us who can help you do that work. And then let me put one last thing out there, which is really important for me. Look, these are really significant challenges that require that people not be timid. At the end of the day, you can't play small ball and have an impact in the housing space or any other space. You've got to be willing to go big, to be bold, to be audacious. And so find partners that you feel comfortable doing that with, and lean in and be ready to be at it for quite a bit of time. This is what they call patient work. It requires stamina and it requires resilience in order to really see impact. I would be remiss if I didn't just say Bernard Tyson just passed, the leader of Kaiser. And if people want to really see what the opportunity looks like and what a difference a leader can make in this space, look no further than beloved Bernard Tyson, who committed his organization several years ago to making a significant investment in housing as a way to improve people's health. And he got about it. He hired good people internally, and he put together an internal team, and they went to work. And Kaiser has been making significant investments of people, time, talent, and treasure in social determinants of health work for a while. And it's because of his leadership, his inspiration, his determination, and his desire to have an impact. And it just shows that leadership matters, and you can actually do it. And I hope that we can find partners, honor and remember Bernard by continuing his work and building on it.
Thanks, Maurice. Those were fantastic insights. And let me just echo your sentiments about Bernard Tyson. I had the opportunity to interact with him and work with the team at Kaiser, and he is just a giant in healthcare and really moving the dialogue and work on the ground and leading by example to help advance health in America. And I know that many of our leaders across the country are very much engaged in this work, it being important to the future of health in this country. And our prayers and thoughts with Bernard's family and the Kaiser Permanente team, and we'll continue to drive forward his legacy of improving health of communities. So let me just add a couple more items to your wonderful list. One, elicit value and respond to what matters to community residents. I think that that's critically important. The other is operating at individual, community, institutional, and policy levels at the same time and finding what are the strategies and channels there. The other is hospitals and health systems know how to do this work, right? The quality improvement movement was one in which you're rigorously measuring what matters, including process and outcomes, making improvements. And so I think we apply the same rigor, and we've seen that through the Hospital Community Cooperative and other initiatives around the country, where the rigor of quality and safety is being applied to the issues of social determinants. So we're measuring and learning from it and then improving in this sort of plan, do, study, act cycle. And then, the team that is developing skill sets in a collaborative, iterative way and can navigate the tensions that are inherent in this work. And I agree with you that it's a long-term game and it's iterative work, and there's going to be uncertainty. There's going to be opportunity to learn and move forward. And we're here along the way. And that's what really the Hospital Community Cooperative has been about, to shape the narrative around diversity and health equity by generating a new class of AHA equity of care champions, providing models of success for other hospitals and health systems, and opening the door for bolder approaches that move systems, environment, policies, and really create this catalyst in some places, move others on the journey that they're already on, and really be a partner in this work. And so to that end, we've produced resources, community partnership assessments, project tools, charters, agendas, communications toolkits, the learnings from the 10 pioneer systems, and certainly the learnings and insights from LISC, Health Begins, RAND, and the Aetna Foundation are our partners in this work. And so we are really excited and proud of our teams and what they've accomplished. And so Maurice, thank you so much for your leadership, for your contributions, and for the conversation today.
Well, thank you and your team. We are excited about our work with you and look forward to doing more. So thanks for your leadership.
Excellent. Well, have a good one.
Okay, my friend. Stay well.